This is Radio Voice of Niger on the topic, how safe is anesthesia? And we have as our guest today Dr. Beate Gehlich, who is an anesthesiologist from Amstelland Ziekenhuis. Fortunately, she was the one that put me to sleep when I was operated upon some few months back, and she did the work very excellently. So I told her when I woke up that, Doctor, it would be nice that I bring you to this radio program so that you can come and tell us the secret of how you made it, because I was too nervous for this, and the reason being that our first daughter died during operation. So you could imagine how intense or intensive it was for me and also for my family. So everybody was calling. My father was calling from Nigeria. All my brothers were calling from the United States. My husband was always with the Bible. Even I had to enter the surgery room with my Bible holding it. But when I slept, I didn't see the Bible anymore. But I believe that God was with me. So Dr. Gehlich is here today discussing about the safetyness that is involved in anesthesia, so that those of you who are afraid to undergo operation, please, it's a very safe technique, isn't it, Doctor?
Yes, it is.
What do you have to say? Am I right in what I'm saying?
Yes, I listen. So, well, you're
Is it safe?
right. You're
Yes.
right.
Okay.
It's safe
Uh-huh.
for maybe 95% of all our patients,
Yeah.
and I won't say it's unsafe, but there are some patients that have a bigger risk to undergo anesthesia.
Yes.
But as long as we still talk about planned operations,
Yeah.
so that I mean an operation where you get a fixed date,
Yeah.
and then you have to come to the hospital to be operated, not an emergency case.
Yeah.
We inform those patients before that they may have a bigger risk for anesthesia.
Okay.
So what patients am I talking about? I'm talking about patients that are really, really ill before they come into the hospital.
Mm-hmm.
Patients with bad function of their heart, patients with, for example, bad sort of asthma, lung
Yeah.
diseases,
Yeah.
patients that are much too big, or patients that are really old. And then I'm not talking about patients from 60, 70 years. I'm really talking about patients about 90 years, 85, and it's not rare nowadays that we do still operate those patients.
Okay.
For somebody who is fallen on the street,
Yeah.
and somebody who has, for example, to undergo hip replacement.
Yeah.
There are quite old people in this group.
Okay.
So 85 and 90 years, it's not rare anymore.
Okay. Okay. So, Dr. Gehlich, can you tell us, if for some patients who normally have allergy, so what about if they are allergic to anesthetic?
Well, that's one big part.
Because sometimes some people get skin rashes when
Yes.
they are giving that.
Yes.
Is it not?
Yes, it is.
Okay. So,
That
how do you handle that?
It is a part,
Yes.
and not only a small part of the questionnaire that people have to fill in before the anesthesia.
Okay.
One question is, do you have any allergies? And if so, please tell us details what kind of allergies.
Yeah.
So, most people don't suffer from allergies for anesthetic medication.
Okay.
Most people that have allergies for dust at home,
Yes.
or for insects,
Or for hair.
for hair from
Yeah.
animals,
Yeah, like myself.
or for flowers
Okay. Yeah.
outside, grass, flowers.
Yeah.
Or they are allergic for certain kinds of antibiotics. That's the stuff that you get for infections.
Yes.
And then we can just avoid that type of antibiotic. That is quite simple. There are other people that are allergic for certain types of nutrition.
Yeah. Okay.
Nuts, for example, or soya products. That is a bit more difficult for us because one of our anesthetic medications is based on soy oil. But then we always can choose another medication, so that makes it safe again.
Wow.
And we try as much as possible to figure out which kind of allergies does the patient have and what can we do to prevent complications. There is a bit of a problem if somebody is operated for the first time,
Yeah.
has never had antibiotics before, has never had operation before, never anesthetic before, nothing, and maybe he is not aware of the fact that he has an allergy against certain type of medication. But even then, if we see somebody developing an allergy as long as he is under anesthesia, it's not really a problem, because then we can give other types of medication to prevent the allergy, or to make it better again.
Okay.
And really, it is the safest place where you can get an allergy, because you are on the operating monitor.
Yeah.
So your heart rate is measured, your blood pressure is measured,
Okay.
everything is measured. So normally, if you get an allergy in a restaurant or at home, nobody is measuring those things.
It's true.
But we are. So it's a safe place to get an allergy if it happened for the first time.
Okay. So how can we, or what can we do to prevent post-operative pain?
Well, there is, in the first place, there are just pills, painkillers that you can take. Second place, if that's not enough for bigger surgery, you can get some painkillers in your blood vessels. You normally have some sort of IV line and infusion where you also get the sleeping medication through.
Yes.
And that stays in one of your blood vessels, in your head or in your arm, and then we can also give painkillers postoperatively.
Yeah.
What else can we do? We can anesthetize a certain part of the body by for example, the lower part of your body to prevent pain in your lower abdomen or in one of your legs or your knee or your foot. So that's possible.
Do you give IV to every patient, or and when can it come out?
IV. What do you mean by IV? A line
IV.
before
The intravenous.
Yes, we give it to every adult. It's a kind of a safety procedure, because we want to be able to give medication every minute of the surgery. And what is the most effective way to give medication to a patient is to do it IV. We don't give it to every child, because children sometimes undergo very, very small surgery, and it's not really necessary then to give them IV. It's only necessary to put them asleep for a moment with a sort of mask.
So what happens?
Every adult does.
What happens when I go to sleep then?
Well, what happens? Let me start with what happens when you are brought to the operation theater. You will normally in our hospital can only tell things and how they are done in our hospital. So we are going with the patient to the operation theater. Then the patient has to lie on the operation table.
Yes.
There you will be put first on the operation monitor. So first thing we do is what I told before. We measure your blood pressure, we measure the heart rate, and we measure the amount of oxygen that's in the blood. And if everything of this is normal and good, then we start through the IV line with the sleeping medication. So if you're lying there, first thing I will tell you is now I'm giving you some painkillers to be sure that you and also your body, if you're unconscious, doesn't have problems with the pain that is caused by an operation. And then afterwards I give you sleeping medication. And then in a few minutes you just fall asleep.
Yes. So what was the difference? Because when I was in the hospital, there were some ladies that they brought to the ward, to my room, and they had anesthesia Medicare by themselves. They were pumping something. But in my own, I had to always bell for the doctor, for the nurses to come and infuse it in put it in a drip or whatever. So what was the difference? Why do I have to take that one? Why didn't you give me the one which I have to measure by myself?
I'm not sure if I remember it right, but I think you not only had anesthesia, I think you had only some sort of catheter, some small drip in your back.
Yeah,
right?
yeah.
And because of this one, you, it was not necessary for you to have the other pump.
Okay.
That depends on the type of surgery. So there are patients that are get only pills against pain after the operation. That is more or less the people that will come to the hospital in the morning and leave the hospital in the evening, but really not staying overnight.
Okay.
There are other patients that stay overnight but undergo small surgery or smaller surgery, and they sometimes get pumped. The pump is filled with some painkillers, and then the patient can give themselves as many of the painkillers as they need. There is a third group of patients where we think, okay, the pain after the operation may be that intense that it's necessary to give not only the pump but to give some local anesthetic, so to make the parts of the body less sensible for pain after the operation, and that's what we do to you.
Really?
So we try to make all your lower part of the body less sensible for pain for the first 2 days after the operation.
So that was for a daily operation then?
Yes.
Wow. Oh, you did a wonderful job in my in my body then. Wow. So what about if one gets addicted to pain, to painkillers? Because you know, when I was demanding for the pain relieving tablets, the nurses were not giving it to me all the time. But contrary to America, in America they will put you on heavy painkillers until you gain back yourself. But I saw that it was like they were rationing what they were giving to me, and I was in severe pain.
The problem is that painkillers are not only doing a good job, but they also can cause problems.
Oh.
If you take too many painkillers, strong painkillers,
Like
morphine,
yeah, morphine, yeah.
You can stop breathing if you take too much. So
Oh.
that's really not what we want patients to do after an operation.
Yeah, okay.
The other thing is that those painkillers, they are not really good for the intestines. So they can cause problems with the intestine. That's that's why we stop as soon as possible with this sort of medication. It is very important to have all systems of your body working as soon as possible again after an operation.
Yeah.
And if your bowels don't work properly, if your stomach is not working properly, if you have problems with nausea and vomiting, for example,
yeah,
then it's not good for the recovery. And the morphine can cause nausea and vomiting,
yeah,
and it can trouble your bowels and your stomach. So that's the reason why we choose other painkillers, and that we try to stop the morphine in patients after 2-3 days.
Okay. Wow. I was really looking for the morphine, because when I take it, then it's like the pain quickly reduced, because I was really in severe pain for about 3 or 4 days. It was terrible. And when I was discharged, I had to be rushed again to the hospital. Yeah, because the pain came so severe.
One problem is that pain is something that is very, very individual.
Yeah.
If 10 patients undergo the same operation,
yes,
maybe that patient 1 doesn't have pain at all, and patient 10 tells, I had severe pain for 4 weeks.
Yeah.
The pain is really, really individual.
Okay.
So that makes it difficult to really find a good match in medication for every patient. And that's also the reason that we have to see how does the patient react if he is in the recovery room. You remember we had, after the operation, you're not going back to the ward immediately.
Yes.
But there is a recovery room where you're still on the monitor, where we try to make you as comfortable as possible with painkillers, with everything you need.
Yeah.
And well, there we have to decide what we do in the post-operative phase with the pain of the patient. And because we expected that you would have quite a lot of pain, we gave you the catheter that you had in your bag.
Yes. So that is different from the normal one.
That is normally...
What did you call it?
We call it epidural catheter, and it's kind of local anesthetic that is given continuously through a little line into your bag. And the local anesthetic will be given close to the nerves in your bag.
But you told me that was very risky because you said if there's any mistake at the vein or whatever, that will cause paralysis.
It can cause problems, and that's the reason that we only do it in awake patients. Because we want patients to tell us what they feel when we bring in the catheter.
Okay.
So, and if you tell us properly what you feel, if we do the procedure, then, well, I honestly haven't seen any problems in years. So
Yes.
also quite true. It's quite safe.
Right. So the nausea that people feel after surgery and the sore throat, is it part of the anesthetic medicine given to them?
Nausea.
Or is it as a result of the anesthetic medicine given to them?
Sometimes nausea is part of the anesthetic medication that patients get. There is a group of patients that is more where it's possible with more frequency that they will have nausea and vomiting after an operation. That are women, young women.
Okay.
And there are also certain types of surgery where it's more possible to have nausea and vomiting after the operation. But because we know this, we give nowadays, that was not so in when you underwent the anesthesia or the operation, but now we give every patient that comes to the hospital something against nausea and vomiting before we start with the anesthesia.
Oh, that's good then. Yeah, that's very good then. Yes. Wow. So, at what point will people receive blood infusion during surgery?
Well, if they lose a certain amount of their own blood, you have as an adult around 5 to 6 liters of blood in your body. That's normal. And if you lose a certain amount of it, and we see that the body can't deal with the blood loss alone, that the blood pressure is dropping too much, that the heart rate is going too high, that the patient will have difficulties recovering from the operation if we don't give some blood to him when we start with it. But well, we all know that blood is really, really expensive, that there are some problems that can be caused because of infections you can get from if you get blood from strangers.
Yes.
Also, it is very well investigated here in the Netherlands. But well, you can get some problems with blood donation. So we try to restrict it as much as possible.
But when I was waking up, I think I saw that blood was given to me. Was blood given to me during
I honestly don't remember. I don't know anymore.
So, before we round up, what are the common risks of anesthesia? What are the common risks from, tell us sincerely, what are the common risks involved in all of this?
Okay. If you ask a surgeon what are the common risks in surgery, normally he would say, well, maybe you have a bit pain, maybe you lose a bit blood, maybe you get a hematoma, but normally he also should tell you that some people have died on this sort of surgery, and it's the same with anesthesia. So if you ask me what are the problems that I have to expect with anesthesia, then maybe I'll tell you, okay, maybe you have problems with nausea and vomiting, maybe you have a sore throat, because at the intubation, the little tube that is put into your throat to make it to make sure that you are breathing properly during the operation. Maybe you have a chance of an allergy if you don't have had anesthetic medication before, but really serious problems, really serious complications and side effects, we barely see. To be honest, I should, if I look to, for example, in America, an anesthesiologist or a surgeon has to tell people you have a chance of 1% or so to die during the operation, or you have a chance of 0.0% to don't wake up after the operation. It's not that strict here in the Netherlands. What we do, we inform patients about the common risks, common problems that we saw everywhere, every week, that we saw a few times a year. But, well, it's not that we don't want to inform patients, but we also want to take the anxiety away from the patients.
Exactly. That's very important.
And the fear. And that's the reason that I'm not telling everybody you may die from anesthesia or you may die from surgery. Because that's really not true for most of the cases we saw every day.
Yes, it's true. So, are there any latest development in this field of medicine which you want our listeners to know before we sign off?
Well, anesthesia, like other specialties in medicine, is constantly in development. And I think the most important things that have been developed last years are all the possibilities for really, really sick patients to undergo anesthesia in a safe way. And that's because there are quite a lot of instruments and quite a lot of possibilities to measure every thing about lung and heart and everything in a patient during anesthesia. So I think it's the most important thing is to make it safer for the patients, and we're still busy doing this. And we're also looking at better ways for patients with pain after operations. We're also looking for patients with chronic pain. And the techniques that are possible in these fields are much more than, for example, 10 years ago.
Well, Dr. Gehlich, reading through your bio, I found out that you've really worked in this field for almost 24 years now. But why haven't you been to any of the third world countries at least to go and do something there?
I haven't been to what?
Any of the underdeveloped countries.
I have been there. I have been in Ghana.
Oh, really? And you couldn't? Really?
Yes, really. It's true. And I planned to go back and to work there for a while, but then I had little children myself, and it has not happened till now. But I have been there in a university hospital in Kumasi. And I've been there for 2 weeks, just walking around a bit with a colleague from Nigeria. To see what they are doing there, and to get an impression how anesthetic and surgery works in those kind of countries. And I've also been in Nepal. And in Kathmandu I also have a university hospital, and I've been seeing surgery and anesthetic and also intensive care as well.
Wow. So when do you intend to go back to, at least go to Ghana and add to what we are doing over there?
Well, I would like to go tomorrow, but I think that's not possible. So hopefully I get back one time.
What is your advice for our audience regarding this important topic? What are you telling us before we sign off?
Well, my advice to every patient is be honest with the doctor. Tell everything that is necessary for surgery and for anesthesia. And don't refuse to ask any question you want to ask. because doctors are also human, so patient is allowed to ask everything he wants.